guys, welcome to my podcast, Fab Academic Unfiltered. If you've been following, I'm sure you know that I talked about Unjolo, I talked about the risks of being of unplanned pregnancy as a girl on campus, and those who choose to do an abortion, legal way or not legal way. And then I talked about the boys too, the fact that it's not your decision whether you get a baby or not. We women make decisions. But of course, I talked about these things as if it's just, decisions that we make. It's just social things. So today, I've got Dr. Rita. Dr. Rita, welcome.
Thank you.
And Dr. Rita, is a doctor at the which hospital in the Livingston. And because she's there, she comes across. So I've been talking to her about the risks involved in pregnancy. What happens? So, Rita, so when you have someone on campus and they fall pregnant unplanned, they have a boyfriend, they're sleeping around. Well, they might not even be sleeping around. It might be with their steady boyfriend, and suddenly they're pregnant, but they don't know. And when you don't know that you're pregnant, you don't know because you didn't plan, and you think you've been surviving this thing, and suddenly you're pregnant. And it's one of those smooth ones. You're not having morning sickness, you rush into class, everything's hunky-dory. But you're going to parties, you're living your life as normal. You're partying, you're drinking, you're whatever. I often think, are there risks, though, that we should make students aware of those risks? Because they may not be deliberate, but then they are putting either their lives or the life of their unborn baby in danger. What are the risks?
Absolutely. So, firstly, being pregnant should be something that is pre-planned. Unfortunately, that does not happen all the time. And the benefits of pre-planning your pregnancy is you get to start taking supplements. Okay. So the most important supplements is iron supplements and folate. Okay. Folate helps with the development of a baby's, basically the central nervous system, which is the brain and the spinal cord. And
we don't produce that stuff naturally?
It does, however, you need supplementation. You need excess supplementation. The same with the iron. What ends up happening is you have to think about it in the sense that your blood supply is enough for you. When you have another person growing inside of you, literally another human being, who is using your blood supply. So everything almost has to double. So those supplements just help in helping your body recreate the blood supply a bit quicker.
Okay.
Yes.
Okay.
So there are always risks associated with having unplanned pregnancy. And one of the risks is the risk of genetic mutations. Unfortunately, that happens to everyone. Whether it's planned or not planned, there's always going to be a risk for chromosomal or genetic mutations. Okay, that's the first thing. So,
genetic mutations.
So if we have 46 chromosomes in a cell, and how a baby comes across is you have the egg and the sperm, and the egg has 23 and the sperm has 23, and they come together to form one cell with 46. And that cell then has to replicate many times, like over 1 million cycles of replication, to then start forming organs, which then forms a fetus, which is what we know as a baby. But in that process of replicating, if you can imagine, if that cycle has to be repeated millions of times, there's always a chance of error.
Oh,
yes. So if there is even a simple error with one gene, that alters the makeup of that cell, which can therefore then alter the makeup of that entire fetus.
Okay.
Yes, which is what actually usually happens in a lot of first trimester pregnancies. So the first 3 months. Which, whenever someone comes with a first time into pregnancy, the first thing we tell you is, it is not your fault. There's nothing we could have known. There's nothing we could have done about it. Because a lot of the times, it's genetic related. Okay. So, being pregnant and you are unaware that you are pregnant means you're not taking the supplements that you should be taking. You're not taking care of your body the way that you should be taking, and you're not staying away from certain substances that you should be staying away from. Things like cigarette, nicotine.
Really?
Nicotine is one of the most dangerous substances.
When you're pregnant. Does it matter how much? If I take 1 cigarette a day?
Nicotine.
And what can it do to my baby?
So one of the things that it does, it causes growth restriction. So on average, average, a healthy term baby is the weight 2.5 to about 4 kgs. It causes the baby to not grow. Then you end up having a baby full term, 9 months old, who's 1.5 kgs. Now that just has a lot of complications for the baby because they become very hypoglycemic. They literally die from cold. Babies die from cold. And that's because their body is not mature enough to produce enough energy to keep the baby warm. Yes, so all those other complications is because their gut is not healthy enough. It's not mature enough to be able to process the breast milk that you're getting.
But we may be talking about this, and there may be some young woman, mother somewhere who says, oh, they're talking nonsense. I've had all my 4 children. I was smoking, I was drinking. Look, one is a doctor, the other one is a psychologist. Of course, this one who's retarded is her father's problem. Do you know what I mean? Like we hear those things often.
No,
how does that happen?
So it all has to do with risk.
Okay.
Everything has to do with risk. Even with nicotine or alcohol, the risks of having a child with FASD, which is fetal alcohol syndrome, is related to a lot of other factors rather than how much you take in. So it's when you take it in, that first 12 weeks is absolutely crucial because that's when organs are being formed. That's when your baby's heart develops.
But are you saying anyone who takes alcohol or who smokes in that first trimester, 100% for sure the child will have consequences? Because there will be many people who say, no, I never stopped.
So, no.
Okay.
It just increases the chances of having a child who will have some sort
Does
of
research give us the
intellectual
percentage?
disability. So far, it ranges, unfortunately. It can go from 2% all the way up to 12%. So the range, it's very different. So unfortunately, sometimes you can be the unlucky one and have the child and fall in that 12% of people whose child will have intellectual disability or fetal alcohol syndrome because you're exposed to substances. And maybe you may be the fortunate one and your child comes out and baby is completely healthy.
Okay.
Yes.
So the tip here is it's better not to take a chance.
Yes.
So it's better to plan the pregnancy.
Yes.
Then you know from this point I'm not smoking anymore.
Yes.
I'm not drinking. You did talk about alcohol. Alcohol also causes the same.
Alcohol causes it's actually a syndrome because it becomes a collection of things. It's fetal alcohol syndrome. It can cause heart valves not to close properly when they have been formed. It can cause an element of intellectual disability. It can cause the baby to be stunted. So the baby comes out, baby is perfectly healthy, baby is the right weight, but baby just doesn't grow well.
Oh wow.
Yes. Or babies are intellectually disabled, and we see it so often in the township and stuff. Oh, slow. You know, slow or yes. And sometimes it is related to that. Sometimes it's genetic or there are other factors, but definitely nicotine and alcohol are some of the most strong contributors in terms of substances that will aid and play a part in intellectual disabilities. And I'm actually quite glad that you said you spoke about planning pregnancy.
Yeah.
I would like girls to know that you have options.
Yes.
That is the most important thing. If you do not want to fall pregnant, you are not planning on having a baby anytime. Firstly, there are women's health clinics everywhere across the country. You can go and find out specifically what is meant for you. It's not just the pill. It's not just the injection. So there's different kinds. There's hormonal contraception and non-hormonal contraception. Hormonal, you've got the pills.
Okay.
And usually that's the pill that you will have to take every day. And I don't think that's very suitable for university. For young people, university, high school age girls, you know. And then they can consider the injectable, which there are 2 month injections, there's 3 month injections, and these are all available at the clinic. Yes, we're available, but they will judge us.
Do campuses have them? Campus clinics, do they have them?
Some of the campus clinics do.
Okay.
Some of them do, but some of them do
But
not.
it's something that the SRCs should say it must be there.
It's definitely something that should be looked into. Yes,
Mm.
because it's definitely part of women's health. And if we
Yeah.
are advocating for
Yeah.
women's health, we can't advocate for women's health without speaking on contraception.
Mm.
And there's definitely long-term contraception. There's the Unplanned, which
Okay.
is a very small rod with hormones. We just put it right
Yeah.
underneath your skin. You do not.
It doesn't
ever
have to go into
do
your
it.
uterus.
No, it goes right underneath there, and it can stay up to 3 years.
You go to the gyno or to a
a
GP.
clinic.
Even the nurse can put it.
The sister at the clinic, where the hospital where I work in, all the nurses put in the implants. It stays in for 3 years.
Okay.
In that 3 years, for some people, it will alter their menstrual cycle.
Okay.
For some people who have heavy period, it may reduce your periods.
Okay.
If for some people it completely stops the period at all, just because of the hormonal process that happens. So it ends up acting.
But you know how our people are. People say, oh, this one said that you put and then you're not menstruating anymore, you'll never have a baby.
Yeah, that is
not true.
That is not true.
Because that has been a story from a long time ago when I was young.
What happens is that rod has a hormone that your eggs will produce.
Yes.
Right?
Okay.
And that just simply suppresses the hormone that is supposed to be produced in your brain that tells your eggs, go make eggs. Okay, the egg can come out now, we are ready. The moment you remove that hormone, it goes back. On average, within 3 to 6 months, your cycle goes back to normal. However, it is also important to acknowledge that people react differently to different hormones.
Yes.
So if the implant doesn't work for you, that doesn't mean you stop.
Yes.
And I think a lot of young girls especially will try one contraceptive and it doesn't work and then they stop. But that's not
and
what
when
happens.
you say it doesn't work, what do you mean?
I mean, maybe it stops your period.
Okay, and then you don't like it.
And then you don't
because it's
like
not a
it.
bad thing to stop your period.
No.
Eh?
And then some people will say it causes me to weight gain, which research hasn't really been clear about.
I was gonna ask
whether
about
that actually does play. Research has not been clear so far whether it actually does cause you to weight gain or not. But if you can go to McDonald's and order a burger and you don't like it, then you try KFC.
Then you can do the same.
Then you can do the same with contraception. And if you do not like any of the hormonal options, you go for a non-hormonal one, which is an IUD, which is usually made of copper. They insert it in your uterus.
That one goes into the uterus.
Yes.
Okay.
It stays there. Yes.
Okay.
It can stay there for up to 5 years.
Okay.
That one, because there's no hormones, does not alter your periods in any way. Your cycle remains the same. The only thing that it does is it prevents the egg from implanting itself into the cavity of the uterus, hence preventing you from falling pregnant.
Okay.
Does not. And the other important thing is, even though it can stay up to 5 years, if 1 year in you're like, I just don't like it, you can absolutely go to the clinic, have them remove it, and we try something else.
And it's free.
And it's free.
Okay.
And it's available. And if that one is not available, there's always another option that's available for you. So having an unplanned pregnancy because you were not on contraception at this point and this day and age should not be an excuse.
Yeah.
Because there's so many options that are available.
Absolutely. I mean, we've talked about two very important things. The risk of falling pregnant unplanned and what could go wrong because you continue living your life as if things are normal. And you are saying, even if I take a small little glass of champagne every time I'm at a party, I'm putting my child at risk.
You are putting your child at risk.
Every time, even if I smoke 1 cigarette a day or a week, I'm putting my child at risk. That's what.
You are increasing the chances of having something go wrong with the development of the baby. And the other thing that is not well communicated is, unfortunately, the risks that come with being pregnant for the mother.
Okay.
There is a lot of complications that happen with pregnancy when you are dealing with extremes of age. So very young and very mature.
Yes.
Not old. Very mature.
Yes.
And that's just because when you are pregnant, your body literally has to go into a mode where it can survive for you and for someone else. So
and you are saying 2 people because it could be that if you're expecting twins, then it's
that's more. Okay, because then that's you and someone else. Then you have another +1, and then sometimes it's a +2. So it just increases those chances. A lot of times you find with extremes of age, you find a lot of obstetric emergencies, and one of the common ones is actually preeclampsia, which is it's actually a spectrum. It's hypertensive disorders where you get blood pressure problems as a 70-year-old. Yes, you get blood pressure problems simply because you are pregnant, and that's just because of the physiology of what happens and how your body alters when you are pregnant. and you are 17 years old, you fall pregnant, you've been fit, healthy,
Yes.
completely
And
fine.
suddenly,
You are going to the clinic, they don't pick up any blood pressure problems, so they leave you, and one day you have a seizure.
wow. Once pregnant,
You have a seizure.
why don't they pick it up at the clinic? Don't they take blood pressure?
They do take blood pressure, but
Okay.
unfortunately sometimes it's very subtle.
Oh.
You won't see the difference, and you won't see that much of a dramatic change in the blood pressure.
Okay.
Yes. So sometimes you won't come. Some people do come in with blood pressures 200
Yes, yes.
over 160, and sometimes it's very subtle. The development is subtle, and then you get to a point where you develop the blood pressure problem,
Wow.
and it is not seen, it is not treated, and it complicates very acutely, and then you have a fit, and that's when you say you are eclamptic. And when you're eclamptic, your life is at risk, baby's life is at risk, because when you are having a seizure,
Sure.
that means there is electrical imbalance in your brain. That's what happens. The convulsing is because there's an electrical imbalance. So for that moment, your life is at risk, baby's life is at risk, circulation is a problem, all those things. And unfortunately, we see a lot of the younger people coming in with these obstetric emergencies.
Sure.
And
Wow.
it's
And-
very, very
And it's life-threatening. You could die.
You could absolutely die. You could get a stroke.
If you get
You
a
could
stroke whilst you're still pregnant, does it affect your child, your baby, unborn baby as well?
I think it indirectly does, because if you have a stroke, that means it depends on where the stroke is. Now, if you are having a clot in the part of the brain that controls your heart, that means your heart will not be pumping as well as it should, which means your baby will not be getting blood as well as it should. So it's always it's a spectrum of disease. So it depends on where the stroke is. But ultimately it does, because your well-being, if you are not well, baby indirectly is unwell as well.
I want us to end, but I know that we've talked so much detail, hugely useful. I mean, I'm listening, I'm thinking, phew, I wish I had that when I was a student. It's good that I made the right decisions, that I never had to deal with that. But I know how many young people, young students, first year, just get into Mojolo, puru pregnancy, and things just, wheels come off. For some, the baby gets born, there's other issues. For some, there's no issue. But it's important that everyone is ready and prepared and knows the risks. Because if you don't,
Absolutely.
then you can be in harm's way unawares when you could have made the right decisions. So, and that's the reason why, you guys, I'm talking to you about these things, so that you make the right decisions. I don't want you to hear about these things when you complete your degree, when you say you're old. So please, tell your friends to watch this, because as long as you're having sex, right?
There's always going to
There's
be a risk.
there's
There
a risk.
is no such thing as good pull-out game.
Oh no, please!
There
Can you
is
go into
no
that?
such
What
thing
is
as
this
a good
thing?
pull-out
What is
game.
this thing that people think you can just pull out?
There is
And
no.
just when things get hot
you
and
just
you pull
need
out.
one sperm.
Yeah.
Just one. You do not
Yes.
need a million, because when you fall pregnant, it's one
It's
sperm
one.
and one egg.
But Rita, imagine, I've always had students talk about the pull-out game and whatever, and I'm like, imagine Mojolo, you are having sex with your person, just at the point of enjoyment, pull out. That's why it never works. No, guys, no. I mean, what do young people think? Rather not have it at all, because how do you do that? And then you are saying, well, you might pull out at the point of enjoyment. So just imagine, you didn't even enjoy, and now there's a baby.
And now you are expecting.
Exactly.
Absolutely.
And then you didn't know that you're expecting because there was a pull-out game. You continue smoking or drinking your
Yes.
wine once in a while, and then it affects your baby.
Yeah, and if you have that unfortunate case where the pull-out game does not go as
Yeah.
well as you had planned,
Yeah,
there are still measures
There
in
are.
place.
they are.
There's emergency contraception, which is available at the local clinic, at any hospital,
And that's after
and
the
it
fact.
clicks.
That's
Yes.
after.
That's after. So you can have
Ah.
contraception before before
Yeah.
reception happens. And if you do not have contraception in place and you do the thing and then there's no pull-out game, the pull-out game is boring and it's whack, you have 72 hours
But you see, when you did
to
the
get emergency contraception.
yeah, but you see, the problem with the pull-out game is that as long as you did it, you think that you're safe. You see, the people who do the pull-out game are the most at risk. You see, the people who didn't do the pull-out game, who say, oh, I'm enjoying, let me just enjoy. They can have the after the fact and solve the problem because they are not ready, blah, 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 blah. But if you do the pull-out game, you think you're safe.
That's true.
And then you discover when the periods don't come, and then you discover, and then
I
it's,
also just want to mention.
and then of course the next thing that's left is abortion, legal abortion.
Absolutely. We do not do anything other than a legal abortion with a certified healthcare professional.
Yes.
If you are going to feel judged, just remember that is your own internalized shame.
Yes.
People are professionals.
Yeah.
We are professionals.
Yeah.
That is your internalized shame. So put your shame aside and come forward, because the illegal abortions, I have seen it so many times, over and over again, where the girl finally comes in when she's literally about to die.
And this is illegal abortions. That's still many.
Yes, there are still so many.
Wow.
Sometimes it's in the back room, yes, mang. Other times they just buy a pill online.
And there are also pills that are sold online that say you drink this pill, it will kill everything.
Yes.
Simply because someone is ashamed just to go to the hospital
Just
and
come,
say,
we will help you. Because what ends up happening, the illegal abortions, they almost always come back septic. They come, they have a widespread infection, they are at the brink of dying. Because your system is failing.
Yeah. But you're also, saying that if you go that route and, even if the hospital can help you, we don't know, are you going to be able to have a baby when that problem is solved?
On
you may
average,
be damaging.
On average, when people come in with septic miscarriages, it depends on how severe it is. So there's these things, we call them, you can have an MVA, but we don't do that because that's quite low. That's done in not in theater, just in the clinic room in the hospital. That if you want to say you had an abortion, a safe one, or you had an incomplete miscarriage, spontaneous incomplete miscarriage, we clean you out, make sure your uterus is healthy.
Okay.
If you have a septic miscarriage, which means you have a widespread infection, the cleaning has to be done in theater. However, the sad thing is some people present so late that antibiotics and cleaning does not help. The only thing to do to save your life
to take out the uterus, because
that's the problem. Now imagine having your uterus taken out at the age of 23. It's not just the fact that you will never be able to fall pregnant and have, you will never be able to fall pregnant and carry your own children. You can still have biological children, but you'll never be able to carry them full term. But all the effects of menopause that people get,
you start getting them now. If your uterus,
and your eggs, if they remove both your uterus and your eggs, your ovaries are the most important bits. If those eggs leave,
fast-track menopause.
You fast-track.
Basically, you are Magriza without having lived the life to get to be Magriza.
So, because life happens, most important thing, plan. Go into family planning. Please consider it. Find what is for you. Find what works for you. Find what you are comfortable with. Yeah. If things happen because of that, this is just how life is. Get the appropriate help. Don't be buying pills online, and don't be talking to random strangers and going into back rooms.
Yeah.
And the other thing, please present early as soon as you know that you are pregnant and you have no intention of terminating the pregnancy. Because one thing about a baby, it will grow.
I listened to some story.
It will grow.
Because it doesn't matter whether you are angry or not, whether you are angry with the baby, the baby will grow.
Babies.
So getting angry and not going to
not being on contraception, you miss your period for 4 months, and you think you're just constipated.
Oh no!
Come on. I have absolutely had young girls come in pregnant. She is 36 weeks pregnant. She's 2 months from being able to deliver. 2 weeks actually.
And it's at that point that she says, I don't want this baby.
No, she comes in and she says, I just don't feel fine. My stomach feels funny. And you touch, you don't even have to scan. You touch, you're like, there's a baby.
You can feel the baby.
And you ask her, did you not know pregnant. She says, no, I thought I was just gaining weight.
Oh.
I thought I was just
But at
constipated.
that time, Rita, the baby has been kicking and whatever.
Yes, they think it's constipation. Oh, kyalunga man. Ish. Kinyoko.
So which means they have probably even drinking the lotanyoko. And that could hurt the baby as well. Or not. The
On
baby is
average-
protected.
No, baby is shielded.
Okay.
Baby is shielded.
Okay.
Yes. Maybe just in terms of you losing nutrients that are supposed to get to the baby, but on average, baby is quite
Babies.
protected.
Okay.
Yeah. So please, please, please know your cycle. Know your cycle. If you're supposed to get your period on the 14th, you wait for at least a week because sometimes the irregularity does
Yes.
happen even after up to 2 weeks.
Yeah.
But if nothing happens after that, please seek help.
Oh no, I thought you would say if nothing happens after 2 weeks, assume you are pregnant. And please,
Assume.
me, I'm the mother. Please assume that you're pregnant. Get a test. Like be clear.
And get the help that you
Get the
need.
help.
And
Don't
your
assume. Otherwise, assume the worst and
Yeah.
and get a test, get confirmation, or go to the
And then you
hospital.
can decide what.
Then
to
you
do
can
with all
manage
the
that.
information presented to you.
That you see, if you assume the best, then you say, it's just too
It's
sometimes.
coming.
And show me at Koskolo, but no, but sometimes you jump a month. It's okay. We'll check out next month because it's getting too late.
That's true.
So
That's true.
yeah, this has been very useful, and I'm sure it's useful for other young people who are not first years. It will also be useful for high school kids because I do these sessions for university students and I talk about first years, whatever. But Mojolo is a thing, man.
Absolutely.
Teenage pregnancies.
Here to stay.
They're here to stay.
It's here to stay.
So we've got to teach as much as we can. So parents, if you're out there listening, rather than get upset that your child is having sex or is deep into Jolo, rather educate them. Expose them to the education because maybe when you're embarrassed to do this education, just get them to subscribe, just get them to listen, so that they can make the right decisions.
And part of that education is still the concept of safe sex.
True.
Let's not forget, because
Let's not forget.
contraception goes with safe sex practices.
Ooh.
Because you may not be pregnant, but that STI is real. And the sad thing about the STI is only you will know, so only you stay with your shame and your symptoms.
I talked a little bit about STIs when I talked about Mojolo. But I want to pause this here because I want us to go have tea, whatever, and then we'll have another episode.
Absolutely.
Where we just talk about STIs. Because when I was at school, even when I was a teacher at school, the issue of groups of nurses going around schools teaching children about STIs was huge. So you were scared, seeing the picture of how gonorrhea looks like.
They always pull out the gonorrhea.
Gonorrhea is hectic,
it actually is as hectic as they make it.
You still
It's quite
see in the
intense.
hospital.
It's quite intense.
Still people come with it.
Yes.
Imagine in 2024.
Yeah.
After all of that. So, but I remember looking at that every time, even when I went to varsity, I thought any guy who looks at me, I'm gonna get gonorrhea just by having a conversation with them. Let alone the baby. Because gonorrhea is scary, man. But there's a range of other things.
There's so many.
And we'll talk about them in the next episode because people all think that it's only HIV, whatever, but there's a range. And so it's important. So join us again. I'll be talking to Dr. Rethakgetse and educating you about STIs of today. And you parents, please get your teenage children to watch, or all of your children. In fact, there's no age limit these days. Children start menstruating at 9 years old. So don't even wait until they become teenagers. Just let them be exposed. And don't forget to write your questions or comments down below, so that if there's anything that you want me to address that affects young people, particularly at university, at school level, that we can get experts who I can talk to, and they can educate our young people.